If hope is the thing with feathers, as Emily Dickinson so famously wrote, then hope is floating all around the extraordinary programs of Georgetown Pediatrics. From the Kids Mobile Medical Clinic, which goes out into Washington's underserved communities to give children a chance for comprehensive medical care, to the Hoya Clinic at DC General, serving homeless families, to Jumpstart, the innovative after-school program, to the cutting-edge therapies and treatments being done every day in every department at the hospital. Georgetown Pediatrics is changing the face of healthcare for our children.
Georgetown Pediatrics is a very special place. I think we represent total, caring, compassionate care to all children in the area.
Georgetown's mission has always been to provide the best top quality care to anyone who needs it. So our Kids Mobile Medical Clinic program provides comprehensive care in the form of a medical home. It's a place where people can go and get all of their care needs met.
Within these walls, families find a community of warmth, care, and compassion, along with a dedicated medical team.
We really try to not only just treat the acute illnesses and the social issues and the mental health issues, but we try to create relationships with our families.
I say all the time, they bought into the concept of more than just healthy child, but healthy families, healthy children.
For Carol Pratt and her 3 children, adopted from the NBC4 series Wednesday's Child, the mobile clinic has been a godsend.
Dr. Levy is incredible, incredible. My children love him. I love him. I love the fact that their start in life was a little different. But when they come here and they meet people that actually care and people that actually are willing to sit and take the time, I often wonder how he has that kind of time, because he does have other patients, but you wouldn't know it.
The kind of care that we provide, it's very comprehensive, and it requires time. And time is something that these families often don't get. And so by us being with them and spending time with them and getting to know them, we're better situated to be able to address as many of their needs as we can to get them on a path, to help them get on a path of a healthier living. And hopefully that will help the children grow socially, emotionally, cognitively into mature, self-sufficient, healthy, and happy adults.
Right? You're going to be a lawyer, and then you're going to go on to be an astronaut, and then you're going to go on to be something else. Yep. Outstanding.
I mean, it means a lot to all of us because, I mean, with the support that they give, I mean, it's almost like they're your doctors, but they're also your family. Like, they make that communication with you, and they have that attachment to you that not a regular doctor would have.
We really try to surround the child with almost like a blanket of care.
They've helped all of us live a healthier life.
Georgetown Pediatrics sees children from newborn to age 21. As part of the mission of caring for all children, regardless of ability to pay, the Hoya Clinic was established to serve the needs of homeless families. During the day, children are seen by top medical specialists. Evening brings special care for adults by a team of medical school residents, providing comprehensive care for the entire family.
The idea behind the Hoya Clinic is twofold. One is to provide top quality care to families in need at the emergency family shelter. And the other is to expose our young health professionals to the complex needs and problems that families in need face in trying to reach good quality care, so that when they go out in their careers, they have an awareness of the disparities that people face, and maybe they'll help to do something about it.
With that awareness of disparities within our society, Georgetown Pediatrics Center for Child and Human Development recognized that some of our city's children face significant challenges in their readiness for reading and preparation for school. Jumpstart, an after-school literacy program, was established to help these children right from the start.
Jumpstart is an early childhood education program that pairs up college students to work one-to-one with low-income preschoolers. This is an early literacy program, and it's encompassing the well-being of the entire child. There's lots of different facets to that, and education being one of them. And Jumpstart is also working toward the day that every child in America enters school prepared to succeed.
Georgetown Pediatrics also recognized another need in the community, that of creating a system of medical care for deaf children and their families.
Most of the families I see are culturally deaf and use sign language, and we make it culturally and language accessible for them. But we also see children who have hearing loss for a wide variety of reasons, and their families as well.
Providing a full complement of services, from a pediatrician fluent in American Sign Language to an interpreter who helps families with all administrative issues and questions, and a nursing and reception staff ready to help. This is the only program of its kind in the Washington area.
I think if you can empower a family to be fully in charge of communicating about their child, who they obviously care very much about, that's going to really give them a sense of empowerment and a sense of owning that knowledge. I can make decisions for my child. I don't feel like I need to leave it to somebody else. I think this clinic, more than anything, provides them an opportunity to have a personal relationship with a physician. They don't need to, I have an interpreter available for the things other than my visit, but when they come see me, they communicate directly with me. I'm familiar with the culture, I know the language, and they have direct access to a physician, and they have the same close relationship with that doctor as another family would who's hearing.
Georgetown Pediatrics is best known, of course, for its cutting-edge therapies and treatments, and the innovative state-of-the-art medical and surgical programs within this hospital for children.
We're big enough and have the expertise and the technical abilities to take care of the sickest children, from children who need transplants, to children with severe cancer, to children with severe respiratory illnesses. And yet at the same time, we're small enough that everybody knows everybody else.
I fell in love with the philosophy of this program. Don't just treat the disease, treat the whole person. Treat the patient, treat the patient's family, which means we treat the mind, body, and the soul of the patient. Because when a child walks into our clinic here or walks into our program, irrespective of whether he has a chronic blood disorder or whether he has cancer, we just embrace them. We embrace the children from the minute they walk in.
For Lori Jones and her daughter Mackenzie, this philosophy saved them.
When Mackenzie, my daughter, was 5 months old, she was having some odd symptoms that brought us to the emergency room in the middle of the night, and turned out that she'd had a stroke.
In the midst of several months of treatments, again, Mackenzie was rushed to the hospital with another series of unusual symptoms.
It's a rough day when it's Friday afternoon and 10 doctors walk into your room to tell you the news that they found basically a lesion on your child's brain. We had no idea. Here, her body had just gone through a traumatic stroke, and then to turn around and have this brain stem lesion, we didn't know if she'd ever walk or talk. I mean, we were always hopeful through prayer that she was always going to survive, but we didn't know what her life would be like, what her quality of life would be like. And the doctors here have just been with us through every step, every department, every division, the best of the best. They've guided us through this process, and she's done great now.
Dr. Aziza Shad was one of the attending physicians who cared for Mackenzie.
I think it took the whole team of pediatrics at Georgetown to really concentrate on her and make sure that she is what she is today.
Georgetown has saved her life, not only saved her life, but brought her a fabulous quality of life.
For the many children treated for chronic disease, ongoing research and clinical trials have yielded life-changing results.
He has now doubled his weight. Can you believe that?
That is
he has exactly doubled it and grown 14, we figure out 14 and a half inches in just 4.5 years.
For chronic disorders of the liver, pancreas, and gastrointestinal tract, a new arsenal of biological therapies and treatments have transformed the trajectory of disease.
With such agents, we can actually turn the pathways off, almost like a switch, and stop the disease or the manifestations of the disease in its tracks. Well, you couldn't tell you have this disease, Mark. You're a picture of health.
While such therapies have given many children an opportunity to lead a normal life, There are some young patients who face life-threatening organ failure. Recognizing clear need, Georgetown has established, under the leadership of Dr. Thomas Fishbein, a transplant center that has given new hope to these families. For little Cyrus Boggs, Georgetown Pediatrics rewrote the story of his life. He received a 4-organ transplant, essentially the entire digestive system.
He was definitely a miracle child.
They came to Georgetown after other hospitals had given up. Unwilling to let their child die, they fought for one more chance.
Because of Georgetown and because of their resources, and they have never given up on Cyrus. And that's a big thing. They have never, even when we have not known what to do, they have never given up on Cyrus. Georgetown definitely saved my child's life, not only my son, but my whole family. I have 2 daughters, and he's a huge part of our family. And without him, we wouldn't be complete. They've really saved our family, not just Cyrus.
Remember how sick you were? Now you're so good. You're such a miracle baby. Do you know that? Yeah.
I think what's unique about us is the fact that we provide, on one hand, cutting-edge medical care to children. At the same time, we're able to maintain a compassionate environment. We're able to maintain this special touch and special connection between the physicians and the medical staff and the patients and their families. And we have been also practicing patient-centered care.
A critical component of care is to create an environment where fear is not first.
So at Georgetown, irrespective of what department you come to in pediatrics, whether it's oncology or cardiology or it's surgery or it's the ICU, the focus is on the patient. And what we really try and do is make it as pleasant an experience as possible, try and take away the fright and the fears of the family, and make sure that when the child leaves the hospital, they feel that they've been well cared for and that they've been loved during that period of time they've been with us.
Recognizing that keeping a child pain-free would also free them from the trauma of a hospital experience, Georgetown instituted one of the first programs in the country that created pain-free diagnostic testing and treatments. Child life specialists make it their mission to keep a child centered on the joys of living, not on the illness that keeps them there. It is a unique team approach. Georgetown Pediatrics is a world of caring individuals working together to change lives.
One of our greatest challenges, I think, is that Georgetown Pediatrics is Washington's best-kept secret.
And that should change. Every day, these programs bring new hope that another child's life takes a turn toward health and happiness.
Georgetown Pediatrics, they care about all their customers one at a time.
Georgetown Pediatrics, making the difference, one child at a time.